Yesterday we spoke about the very brief anatomy and physiology of the gastrointestinal system. Today we'll start from above downwards, but today we'll talk something about the esophagus. Esophagus, as we were discussing yesterday, it is a tubular structure of about 25 centimeter, approximately 25 centimeters in length, and it is a tube through which the food passes down into the stomach. So what are the diseases that occur in esophagus? That's a quick question for you. You just type whatever disease comes to your mind. You can type only esophageal related diseases. You can type and let me see how many diseases you get. There are many.
Barrett, GERD.
Barrett, GERD.
Barrett.
Barrett's, GERD.
Achalasia.
Achalasia. Excellent.
GERD.
Yes.
Cauliflower cancer.
Cauliflower cancer. Varices. Oh, very good.
Cancer. ACR. Zinkers. Achalasia cardia. Infection.
Infections.
Zinker.
Yes.
Mallory tail.
Mallory tail. Varicose. Excellent.
Operation.
Okay. We'll start talking about a few of the diseases that occur in the esophagus. So, esophagus diseases are not very uncommon. If you ask any gastroenterologist, many people do come to them with the diseases related to the esophagus. So esophageal diseases can be roughly divided into congenital and acquired. In congenital, we have structure-related, motility-related diseases, and in acquired, we have again structure-related, motility-related, and we have tumors, we have GERD, we have infections, we have traumas, and we also have the secondary involvement of the esophagus, secondary to some connective tissue disorders like systemic diseases like scleroderma and some other diseases. Some dermatological diseases also can cause, can involve the esophagus. So roughly congenital, acquired. Acquired, we have structure related, we have motility related disorders, we have tumors, we have trauma, we have GERD, we have infection, so on and so forth. So congenital, when we start the congenital diseases of the esophagus, which is seen in early infancy, you will know if the disease is little more, the newborn baby will have problems swallowing, problems regurgitation and bloating and all those things, excessive crying and all those things. So before going to our congenital diseases related to esophagus, I requested our student, Dr. Arbaz, to talk a few lines about the embryology, the development of esophagus intrauterine life. How esophagus develop? Esophagus develops in two parts, upper and lower part. They come and unite in the center. If this fusion fails to occur, you may have a lot of problems, and sometimes you may get a anomalous connection into the trachea. Then the newborn will asphyxiate. Sometimes they may die within few hours of the birth if there is a tracheoesophageal fistula. These are the various congenital deformity that the few children are born with. And now I'll hand over the mic to our student Arbaz to talk a few minutes about the embryology, development of esophagus. Arbaz, come here. I'll stand next to you here. You can use a whiteboard if you want.
Good evening, everyone. My name is Syed Arbaz, third year medical student from Deccan College of Medical Sciences. I'm Syed Arbaz from Deccan College of Medical Sciences, third year. Today, I'd like to talk. I thank sir for giving me this opportunity to talk about the development of esophagus. First, let us start with the development of the gut.
Before Arbaz continues, I want to give this kind of opportunity to anyone who is willing to talk about any topic for about 5 to 10 minutes. From the student side, anybody, I want you to talk. I want to learn from you, really. Okay, be ready. Please volunteer. Feel free to talk to Arbas. Send your topics, GIT related topics, any topic that you want to talk for short 5 minutes or 10 minutes. Please let us know. We want you to participate. We want you to talk. We want to see how you're talking. Arbas.
Yes, sir. Thank you, sir. So, am I audible? May I confirm if I'm audible? Please type in the chat box. Yes. Okay. So first, let us start with the trilaminar germ disc. What is trilaminar germ disc? The ectoderm, mesoderm, and the endoderm. Let us start with a quick little bit about the fertilization. From fertilization, we know the sperm and the ovum fuses to form the zygote, which is surrounded by the zona pellucida, inside which the cell of the zygote will divide, redivide, forms the morula, which is still surrounded by the zona pellucida. Now, the cells inside the zona pellucida, which is there, they will rearrange themselves to the outer periphery known as the trophoblast and the inner central layer of cell known as the inner cell mass. Yes, the outer cells are trophoblast and inner cells are inner cell mass. These inner cell mass are lying in the center of the zygote, center of this morula, what we say. Yes. Now, what happens after some time? The zona pellucida now.
Slow. I'm not understanding this. Your speed is little.
Okay, sir.
Over speeding.
Yes, sir.
Little slow.
Okay, sir. Okay, so this is the morula that we have. Morula, outer periphery, we have trophoblast cells, and inside we have the inner cell mass. Yes, this inner cell mass, now the zona pellucida will disappear. When zona pellucida disappears, the fluid inside the uterus will now enter inside the morula. Yes, what will this do? This will push the inner cell mass towards one pole of the embryo. So what we have, this is not embryo still, but the blastocyst. Now the fluid has entered inside the morula, occupying that space. That cystic space is now known as the cyst, and this entire structure is known as the blastocyst. So what we have now, we have trophoblast and also the inner cell mass. Now what happens? Some changes takes place in the trophoblast and some changes takes place inside the inner cell mass. Now, actually speaking, our entire human body is derived from the trophoblast or the inner cell mass. Does the trophoblast has any role to play inside the development of the human structure that we have now? May I know in the chat box if there is any? Meanwhile, I'll speak. Yes, the human body as such is derived from the inner cell mass only. Now the inner cell mass will rearrange themselves into the bilaminar germ disc first. The bilaminar germ disc will have the epiblast and the hypoblast. Now from this epiblast and the hypoblast, between that we have a notochord being formed. From the structure of the epiblast, there will be a midline structure being formed craniocaudally. From the caudal end to cranial end, there will be a midline structure in the epiblast. That structure is known as, may I know in the chat box? Yes, that structure is our primitive streak. From the primitive streak, the cells will go down, occupy the space between the epiblast and the hypoblast, and form what? The notochord. And beside the notochord, whatever space is there is being occupied by the cells, the same cells derived from the epiblast. These are now known as mesoderm. Yes, the ectoderm, the mesoderm, and the endoderm. The epiblast cells will replace the hypoblast cells and form the endoderm. It will occupy the space beside the notochord and form the mesoderm, and it will also replace the epiblast cell and form the ectoderm. So this is the trilaminar germ discs that we have. Now from this trilaminar germ disc that we have, will our human body develop? Yes. What will happen now? So there will be a procaudal plate and an anal plate. Yes, we all know that. So what is the speciality of this procaudal plate and the anal plate? Here, the epiblast or the ectoderm is directly attached to the endoderm without there being any underlying mesoderm. Yes, above at the procaudal plate also, and below at the anal plate. And in the mesoderm, above the procaudal plate, there is a thickening in the mesoderm that is known as, may I know in the chat box, that is known as the septum transversum, which is forming the central tendon of the diaphragm, the partition between the thorax and the abdomen, and also the inferior part of the pericardium. Yes, and this is the orientation that we have, the trilaminar germ disc.